Hey, Gibson Cully here with Snackable Health, and we're talking about monkeypox. Payal, what's the update?
We've stopped talking about monkeypox, it seems, but I think we still need to be having the conversations because it's still out there. The good news, Mike, and I always am a glass half full kind of girl, so I want to talk about the good news is that the rate of growth appears to have slowed down. So we're seeing less infection with monkeypox than we were before. And we think there's two reasons for that. The first is that people have changed their behavior. So people are being more cautious. They're trying to protect themselves more. If they have any lesions or symptoms, they're staying away from other people. But the second part of it is the vaccinations, which I'm really grateful for. We've had more of a supply come in. And so we've had more uptake of vaccinations, more people getting vaccinated. We've also changed how we're vaccinating people. So we used to be doing subcutaneous vaccinations where you put it way under the skin, but that required about 5 times as much liquid or a vaccine dose as an intradermal vaccination, which is what we've switched to now, which requires, fifth as much of the vaccine so you can make it last longer and your immune response is still the same. But what I'm seeing that I find most interesting out there, Mike, with respect to monkeypox is that they're doing some genotyping, looking at the genome of the monkeypox virus, and it's actually mutated quite a bit.
Mm. Well, that's disheartening. And is there any need for new vaccines? I mean, is this new strain going to be evading our current vaccines?
That's the question we need to ask. So they've really genotyped, monkeypox strains from this particular infection in Florida, and this is a DNA virus. So it mutates less aggressively than, COVID, the SARS-CoV-2 virus, which is an RNA virus. But when it does mutate, it makes bigger changes. So what we're seeing is large genes actually being changed or missing, and big changes occurring. So we still have to see what this means for the behavior of the virus. But to me, it tells me we got to still keep our guard up. We've got to keep an eye out because this mutations could potentially lead to vaccine evasion or immune evasion, which might require us to think about updating the vaccine as well.
And quickly, Payal, who should get vaccinated for monkeypox?
Such an important question. So anyone who's high risk for exposure. So whether that means it's because of work, your occupation, you work with monkeypox patients or in a lab that processes those, or whether lifestyle choices, it's really important if you think you might be exposed to somebody, particularly men who have sex with men in that community, it's a high risk of exposure, you should get vaccinated. One really good thing to know about monkeypox though, Mike, is you can even get vaccinated after exposure. That's called post-exposure prophylaxis. You have about 4 days within your exposure to get that vaccine. If you get it past the 4 days, it still works to prevent the severity of your infection, but it's not as effective at preventing infection altogether.
Is it still, this is a hot button issue. Is it still largely confined to men who have sex with men, or is it creeping out into the rest of the population?
For the most part, it's still within that community, although we have seen several cases in heterosexual people. We've also seen cases in kids as well. But the large demographic that appears to be affected at this time, again, largely through probably behavioral choices as well as health-seeking behaviors, they get diagnosed a bit more frequently, are men who have sex with men.
Well, good to hear that it's not rising as rapidly. It seems to be leveling off. That's great to hear. A little concerned about that mutation. Thanks, Paul, for the update, and thanks for joining us here at Snackable Health.